everyone, Mike Gaitis here, commercial real estate broker with Go Florida Commercial, helping you buy, sell, and lease commercial real estate here in Central Florida. Today, I'm here with Dr. Jeremiah Bradford, owner and physical therapist at Unified Rehabilitation in Winter Garden. Dr. Bradford and his team have specialized in many different treatments to help their patients live active lives that are pain-free while achieving their goals. Dr. Bradford, thank you for having me here today.
Thanks for coming over and inviting me to do this. I'm excited.
Dr. Bradford, when someone comes into a physical therapist office, what are some common questions a patient would ask their physical therapist?
So when they're in here, a lot of times they want to know what happened, what's going on. You know, if something, we'll just stick with someone who's having pain or discomfort. You know, you want to know why it's hurting, you know, what potentially caused it, how long it's going to take to get better, and what we're going to do to make it better. You know, is it going to hurt? Am I going to have to do stuff on the outside? Do I need medication? Should I go get imaging? You know, I know you said 3 or 4, but there's a million questions. I could,
and that's what you get when a patient comes
exactly.
in.
And you never know what the question's going to be, which is kind of neat in a way because it keeps us involved and it keeps us keeping up to date on the latest research and making sure that we're providing the best treatments because it's always evolving. And a lot of times it's going to be specific to that person. So for example, how did it happen? Well, that's going to be our little detective hats that we put on and figure out like, okay, maybe it's an active lifter and they're having some issues when they go to the gym, or maybe it's someone who's an avid walker and it's like, well, I get hip pain after I walk for 3/4 of a mile and that didn't happen a month ago. Well, let's dive into that. What's going on? Is it a weakness thing? Is it a mobility thing? Is it a ability for the brain to control the right muscles to tell them what to do and for how long? Maybe it's a strength or endurance thing. So it's very unique to that person. And then probably the most common question is, how long is it going to take till I can get back to whatever I want to do? Or
that's what I'm thinking about.
Right.
Exactly.
Or how long am I going to be in pain? Because no one likes to be in pain. That's not a good time.
Yeah.
And it's different for everything. So a lot of times it'll depend on how long it's been there, how long you've been, going looking for the latest, greatest Google treatment or whatever it is. And you put off coming to see a professional to fix it. So that plays a role into it. It also depends, what other treatments have you had? There's so many options out there. I mean, you have your injections, you have your new types of stretching, your myofascial, this, that, and the other thing. And not that they're not important and they don't work, but they have to all kind of be in conjunction, and you have to be working to solve the cause of whatever that pain is. So when we kind of figure out like what caused it, what's going on, we can a lot of times say, well, this is something you're going to need, a couple visits. You'll do these exercises. Make sure to do this kind of warm up before you run or whatever your activity is. Make sure that you're getting plenty of sleep, or you're hydrating, or what does your nutrition look like? Maybe it's something that you're just an extremely active person and you need a little recovery service every now and then to make sure you're keeping your body in check and not overloading the tissues, which happens a lot of time in active people. But also on the opposite end of the spectrum, when people are sedentary or don't move, you can get some of these issues as well. So they have very different answers, and it's very unique to the person. Take a tendinopathy, for example. How long has it been going on? What have you been doing? How are you loading it? What stage is it in? Is it something that's going to take 12 weeks to fix, or maybe it's going to take a week of walking and then getting back into a progressive loading program to get you back to whatever it is, and that's 4 to 6 weeks. But yeah, that's kind of a lot of the questions and a lot of the answers that we give.
Oh, very good.
Thank you.
Dr. Bradford, I really want to thank you for having me out today. If someone wanted to learn more about you, your staff, and all the treatments you provide here, what's the best way for someone to connect with you?
Absolutely. Great question. Best way to connect with us is giving us a call. Our phone number is 407-614-8002. Follow us on social media. Go to our website, which is www.unifiedrehabilitation.com. Our social links are on there. A list of what we treat, how we treat, all our staff member bios, and pictures are on there. So that's the easiest way to really learn about us, to connect with us, and it doesn't cost anything for a phone call.
Well, thanks again.
Thank you so much, Mike, for coming out. I really enjoyed this.
Appreciate
and love to serve our community, and I love doing this with you.
Thank you so much. And I want to thank the good folks over at Splash Social Marketing for putting together this video series. They help businesses of all sizes with the social media they're marketing their website. they can be reached at splashsocialmarketing.com. And again, I am Mike Gaitis, a commercial real estate broker with Go Florida Commercial. Thank you.